Hi, my name is Melinda, and I'm going to be talking to you about Positive Behavior Discipline Program. A positive behavior discipline program is where the caregiver uses redirection so that they redirect a child from doing something that they shouldn't be doing to something that is okay for them to be doing. It is important in the early childhood because it avoids belittling, shaming, blaming, and even criticizing a child. In the lives of infants and toddlers, there is no place for punishment, scolding, or anger. Of course, caregivers will feel anger at times when they can't manage or control the behaviors of children that's in their care. Caregivers, however, have to realize that the anger is personal and should never blame the children for it and never use the anger to control their behavior. If the caregiver tries to use the anger to get his or her way, the children will pick up on it and will try to use it on them as well. Punishment leads to damaging children's self-esteem. There are better ways to change undesirable behavior that keeps a child's self-esteem in place and also enhances self-concept as children learn to control their own behavior and feel good about being rewarded with positive attention because of it. Unacceptable behavior would be behaviors that are not suitable for the child to be acting out according to their age. There are 6 alternatives to changing undesirable behavior. 1. Teach socially acceptable behavior. Children pick up behaviors fast when it is what they see. Therefore, it would be optimal for the caregivers to model the positive behaviors. 2. Ignore the behavior you want the child to change. Ignore bad behaviors because you don't want to give children the attention they desire through the negative behaviors. But keep in mind not to ignore the behaviors that would threaten safety or communicates a need, such as a crying, hungry baby who needs to be fed. 3. Pay attention to behavior that is socially acceptable. Make a big deal about the behavior you want children to use so they feel rewarded and want to be praised again and again, such as children appropriately playing with equipment or toys or even getting along with others. Give them a big thumbs up so they continue to do the same behaviors. 4. Restructure the situation. If there is too many choices or not enough choices at all, sometimes children just need to be separated for a while as well. 5. Prevent harmful behavior from happening. Caregivers need to catch children before they act on something. Things like stopping a child from hitting or biting before they act on it. The strong reaction that children receive from doing these bad behaviors can be rewarding. These kinds of rewards are cut off when you avoid these things from happening. So staying on your toes and catching these things before they happen as opposed to handling it after can make a big difference. And 6, redirecting the energy when appropriate. When the caregiver needs to restrict a child from doing something that can harm others, the caregiver needs to give the child other options that they can do without hurting themselves or others. For example, not letting a child bite another child, but perhaps instead giving them a washcloth to bite on or a soft ball that they can bite on, or a child who wants to throw a toy car at another child, but instead the caregiver gives the child a soft ball and tells them it's okay to throw it so that they can show their anger and their frustration and get it out without hurting themselves or others. Well, that's it. Hope you like my presentation. Thank you.